In this session, we will start by discussing diabetes so that you can get a better understanding of your condition. Some of this information you might already know, but some of it might be new to you. There are three types of diabetes. We will briefly discuss all three and what the definition of diabetes is. Diabetes is a condition that causes blood glucose levels to rise higher than normal. This is also called hyperglycemia. When you eat, your body breaks food down into glucose and sends it into the blood. Insulin then helps move the glucose from the blood into your cells. When glucose enters your cells, it is either used as fuel for energy right away or stored for later use. If you have diabetes, your body either doesn't make insulin, can't use insulin it does make well, or both. If left untreated, it can lead to several complications such as nerve damage, kidney disease, eye problems, heart disease, or stroke. If it is managed well, people can live long and healthy lives. Diabetes may be treated with insulin, oral medications, exercise, and meal planning. Type 1 is the least common of the three types, but the most common in young people. Family history plays a huge risk factor. Type 1 diabetes is a condition that happens when the immune system attacks the cells in your pancreas, which causes it to stop making insulin. That is why people with type 1 need to take insulin every day to compensate for the lack of insulin in their bodies. Some common symptoms include, but are not limited to, weight loss, thirst, hunger, and frequent urination. Type 2 is the most common and often develops in middle-aged and older adults. About 90% of people with diabetes have type 2. It can be due to history, but also due to lifestyle management. Some examples are the way we eat, the lack of exercise, or our weight. With type 2, the pancreas still makes insulin, but it either doesn't create enough or the body does not use it properly. Diabetes is a progressive disease, so even if you don't need to treat your diabetes with medications at first, you may need to over time. So it is important to keep following up with your primary care physician. Some common symptoms include, but are not limited to, urinating often, feelings of extreme hunger, thirst, and/or fatigue, blurry vision, and slowing down the healing process of cuts or bruises. Gestational diabetes develops during pregnancy, and for most women, the levels will return to normal after giving birth. Women who had gestational diabetes will need to be tested regularly after delivery, as they will be at higher risk for developing it later on. Some common symptoms include, but are not limited to, excessive hunger, thirst, or fatigue, frequent urination, and yeast infection. Now we will review how to monitor your levels, the frequency, and overall blood sugar goals. There are two ways to monitor your levels. The most common is a glucometer, that is the handheld manual device. It uses a small needle to prick your finger, which you place on the reading strip to measure the blood sugar levels. The second option is the continuous glucose monitor, also known as a CGM. This is a patch which is worn on either your belly or arm and continuously monitors your levels. It collects data that can be pulled up to an app. This app can send warnings and alerts in real time. The goal and intention is to make it a habit to check your levels about 3 to 4 times a day, whether you use insulin or not. You can discuss how often you should be checking with your primary care physician and make sure you have enough supplies for it. Remember that your specific goals could be different depending on age, additional health problems, and other factors. Consult with your primary care physician regarding your individual blood sugar goals. Here we have the recommendations from the American Diabetes Association, also known as the ADA. It is recommended that before meals and in the morning, it should be between 80 to 130. 1 to 2 hours after your meal, they should be less than 180. And at bedtime, it should be between 100 to 180. The ADA has a standard of care guidelines that anyone with diabetes should follow. One key practice that they cover is the ABCs of diabetes. It reviews 3 key steps that can help you manage your diabetes better and lower your risk of heart attack and stroke. Those are A1C, blood pressure, and cholesterol. A1C is a test that measures your average blood sugar levels over the past 3 months. It is commonly used to diagnose prediabetes and diabetes. A normal A1C is below 5.7%. Prediabetes is diagnosed at 5.7% to 6.4%, and diabetes is diagnosed at 6.5% or higher. Blood pressure is the pressure or force of blood pushing against the walls of your arteries. The arteries carry your blood from your heart to other parts of your body. Normal blood pressure levels are 120 over 80. High blood pressure is twice as likely to strike a person with diabetes than a person without diabetes. If left untreated, high blood pressure can lead to heart disease and or stroke. Cholesterol is a waxy fat-like substance made by your liver. It's not inherently bad. Your body needs it to build cells, make vitamins, and other hormones. But too much cholesterol can pose a problem. Keep in mind that LDL is your bad cholesterol, and HDL is the good cholesterol. Diabetes can be managed with everyday lifestyle changes such as eating right, exercising, and taking your medications. Over the next two slides, we will review what can happen when it's not managed properly and preventative measures you can take. If it is not managed correctly, it can affect your eyes, feet, kidneys, and oral health. Some common complications are blurry vision or loss of sight, end-stage kidney disease, foot ulcers, or severe gum disease. Listed here are additional complications that can occur. Some preventative steps you can take are to have your eyes, feet, and kidneys checked annually. Your primary care physician should be checking your feet at your annual checkup as well as your kidneys. You can also check your feet daily for swelling or abnormalities, and if you sit for work, make sure that you get up and move to get your blood flowing. As for your kidneys, make sure you drink plenty of water, avoid alcohol, and keep your blood pressure in healthy ranges. Your optometrist should be checking your vision at your annual checkup. Your dentist should be checking your oral health biannually when you go for your cleaning. You can also make sure that you brush and floss regularly to avoid gum disease, as it can cause your blood sugar levels to rise. Make sure that your optometrist and dentist know that you have diabetes so they can ensure that any special testing needed is done. Being prepared and knowing what to do when you are sick is very important. Those with diabetes have a higher risk of getting sick and harder time fighting it off. If you do get sick, you may notice that your blood sugar levels rise higher than usual. Even when following the standards of care, it is possible to get sick. We will review several things you can keep in mind to help you, but make sure that you speak with your primary care physician about the best way to manage being sick if it happens. When you are sick, it causes your body to release hormones that temporarily raise blood sugar levels, making it harder to keep your blood glucose in your target range. The rise in your levels may change how much medication or insulin you will need at any given time. The added stress causes your immune system to become even more weakened. As you fight off the illness, it will begin to lower your blood sugar levels, sometimes too low. There can even be an opposite effect at times where the levels go too high. Review your action plan to decide the next steps. When preparing for sick days, having an action plan can assist in the management of your diabetes and decrease the chances of complications. If you do not have an action plan already, consider creating one that works for you with the help of your primary care physician. Here you will find some things to consider when creating your plan. It is important to be prepared for sick days. Make sure you have enough insulin and or other diabetic medications in your home. Listed here are some medications and snacks that you should keep on hand. If you've been throwing up and or have diarrhea, you should take your diabetes medications based on your action plan, doctor's instructions, and or your most recent blood sugar readings. Some steps to take when you are sick, but your levels are within your target range are: continue taking your medications as usual. Test your levels every 4 hours. Weigh yourself daily, as losing weight without trying may be a sign of high blood sugar levels. Check your temperature every morning and evening, and make sure you have enough supplies available. It is common in those who have diabetes to become dehydrated because the kidneys do not function correctly if your blood sugar levels are too high. Dehydration occurs when you lose more fluids than your body can take in. It is important to drink 4 to 6 ounces every 30 minutes to prevent dehydration. Always have regular and zero sugar sports drink options on hand to keep you hydrated. If your sugar levels are high, drink the zero sugar option, and if your levels are low, drink the regular option. It is important to know the signs of your illness and be able to recognize the severity. When you are experiencing any of the following listed here, you should reach out to your primary care physician for guidance. If you are experiencing confusion or having trouble breathing, you should call 911 or go to the nearest emergency room. We have reached the end of the session, so let's review some quick takeaways. Remember to check your blood sugar levels daily, regardless of how you are feeling. Following the ABCs of diabetes will help you avoid complications in your care. When sick, continue taking your diabetes medication and keep supplies on hand. Staying hydrated is important to controlling blood sugar levels when you are sick. Type 2 diabetes is manageable, but if you don't manage it correctly, it can affect important body systems. All flyers and session content are available to view in your program modules.